Hi, good evening, everyone. We had a lot of technical problem. We couldn't share screen just now. So I'm helping Irene to share screen. Irene is actually a nurse by training, but she has actually ventured out to not just many career pathways. She has ventured out to even many places in this world, including spending a few years in China.
Years in China.
Yes. So Irene would be the perfect person to tell them, especially the young nurses, what are the career paths that you can actually take as a nurse, other than just being a clinical, just being clinical nursing. You can do so many things other than that. So without further ado, we invite Irene. Irene?
Hello, afternoon, everyone. I'm Irene from, I have been having my training since doing my nursing job as 40 years ago. This is my 40th year this year. Okay, I have a basic nursing in Malaysia. I have my bachelor nursing via the Edding Cowan University. I have my CCN and neuro also via University of in Perth, Australia. And my diabetic educator is local Malaysia through one of the first batch of through the J&J venture with one of our diabetic core group here. I have my wound care with one of the local, but is with Hertfordshire University. Have my RPS GT is a sleep technicians through University of Sydney. My second slide is actually, I can control the slide, is it, Betty?
No, I can't, you can't. I think I have to control the slide. So now I need to, okay.
What are the origin of nursing profession? It started off with this Florence Nightingale in the year of 1891. The public perception of the nursing contributed to change during the Civil War. Okay, as women make a significant impact, caring for the wounded soldier. That is Florence Nightingale. Okay. Next slide, please. Actually, nursing is a rewarding, dynamic career. There is a lot of, it can make a difference in a lot of people's life and offer a variety of career path and opportunity for professional growth. This is just an example how it was done. When you become a trainer, then you had to go for training. Then it's step by step. Next slide. Is actually nursing career a rewarding career that provides fulfillment every day. Nursing is a professional that offers a variety of career path and opportunity for professional growth. Okay, it's not you just die to be a nurse only at the bedside. You can have a multiple choice when you choose to be a nursing as a professional. Before you become a nurse, you need to have education pathway. That is, you will need to have at least 5 credit in max. I think next slide that is I show after this.
Okay,
yes. So at least in Malaysia, you need to have 5 credit in mathematics, general science or pure science, biology, chemistry, physics, and 3 subjects, and a pass in Bahasa Malaysia or English. But most of that, the best is you have credit in Bahasa and English, you stand a higher chance that when you study in Malaysia context. Let's say you go to Singapore, they need an A. You see or not? Singapore take the prime, a lot of prime nurses, young graduate fresh out from school after the Form 5 or STPM, they need a very, very good credit that you can enter in their school. Okay. After this, if let's say you study the diploma for 3 years, you have to work at least 2 years to go for degree nursing. You see, this is the basic for if you from diploma to go to degree. If let's say you are straight away go to degree, you need to have STPM or at the A level in our educations. Do not this one because do note that subject to individual university that they will take in or training school, they will have their own criteria of choosing for the students to go in. As a career path, the next slide. Career path, registered nurse. After you train, you will become given a title of registered nurse. Okay, that is you have to go into individual country. There is a nursing board. They will give you a registered nurse license. It's a highly skilled and well-rounded profession with diverse responsibility. We need a lot of responsibility. Okay, as a nurse, you get to work in different healthcare setting. It's not only one type of healthcare setting, there is different path. Okay, the next slide. Actually, what is a registered nurse?
Yeah.
When you this one, they are professional licensed by the nursing board in which they work.
Hold on,
Okay.
sorry.
Okay.
Hold on.
What happened to my slide?
No, it's my fault. Because the I'm so sorry. You see this, it won't go up and down, you see. So I also don't know how to, it can only be slide like this.
It's also my fault.
Okay, so this one, nursing career, correct?
Yes. After this, then
After this, okay.
actually, what is a registered nurse? I explained here is they are professional licensed by the nursing board in which they work. RN function as an active member of the healthcare team, and RN provide and manage care for individuals who are ill and their families. Okay, RN also work with healthy individual and family to educate them about the disease and preventions. Okay, we are as an educator. RN work with patients of all age, different type of age from birth until the very old. Okay, to promoting physical, mental, and social well-being. RNs also used to observation and assessment skill to support nursing diagnosis. We also have as a diagnostic personnel in our workplace. Okay, from this one. Example, alteration in skin integrity related to bed rest, potential for infection and surgical wound. Okay. The next slide. Okay. The next slide, is it correct or not? Okay, you can make nursing career, how to be a nurse. You can make a difference in someone's life. As a nurse, you will play a key role in patients. I can't see this one.
You can't see what?
Never mind, I zip full that I can see. Okay. Okay, you can make difference in someone's life. As a nurse, you will play a key role in patient care and be an integrate part of a healthcare team that include doctors and allied health profession. So we as a team member in the hospital, nurses form a backbone of public healthcare system. We are the backbone. You can a big hospital, you have doctors, you have help, but you don't have nurses. 70% of the patient is depend on nurses. Okay. To attract the best talent, develop and retain nurses, more are being to support nurses in 4 areas. We have 4 areas of this one. There is career development, autonomy. I can't see.
Oh, I see. Maybe it's my fault. You hold on, huh?
And then I got my another. I need to use my another computers here also.
Hold on, huh? Sorry. I think it's my fault.
Okay.
Hold on, huh? Sorry, resume share. Share, okay. Okay, this one, share.
I see my here.
Hold on, huh? Resume share. Oh, today really susah. Share. Hold on, something is not right. I'm so sorry. You hold on, guys. Okay, so you were here. Were you not here?
I was in the nursing career, be a
Yes,
nurse.
this one, I think so. This one, right? Right?
No, this is lower. Before that, before. Yes.
Okay.
Okay.
First is
So, yes. No. This is before, after. Just now is the, where do nurse work before that, before the other slide? Before.
no.
After this, another 2 more slide. Now, wait,
We're going back, okay.
you come down. Yeah.
Ayo, what is I'm so sorry.
I am so sorry. I also don't know why today cannot.
Yeah.
Usually cannot.
You see this my okay. Okay, Kennedy. Okay, now Kennedy.
Okay. After this one,
Now cannot pula. Okay.
nursing career, be a nurse. Also, there's 4 areas of support: career development, autonomy, recognitions, education. With care, you
Ayo.
will have opportunity to develop your career further.
Okay, is this one?
Yes.
Okay.
So I explained that what is care. There are better career development with more opportunity for progressions. A is lead a team with autonomy to make decisions, and then recognitions from superior, supervisor, my typing area, and patients. Okay, higher salaries, special bonuses and awards. E is scholarship to help you further your study. And then you come down, another one, next slide. Okay, where do nurses work? The possibility are endless. It's everywhere. 60% in hospitals, or either you are in general or private or community. 19% in government NGO, 19%, and education positions. 8% in clinic, offices, polyclinic, and specialty centers lah. 5% of this is only on nursing home or daycare center. 3%, sometimes the nurses, they will go into HR, employment facility. And then a minimum of them go to hospice, school healthcare, cruise ships. Now we can go, also you can go to military hospital to work, wellness center, public health office. 5% will be home health care agency nowadays. What is nursing career. There are many paths, but one career only. It started with a great educations. Your nursing career began with a diploma or a degree. You either started with degree or diploma. Upon graduation, you will become a registered nurse. That is called registered nurse. You will start a career as a staff nurse and advance through one of the following tracks. Either you go to management, lead a team of nurses, and OC ward operations. Clinical, provide direct care to patients. Education, we equip fellow nurses with higher nursing skill. So you make a difference, you got abundance of career opportunity to be a nurse. Okay, always learning, not confined to hospital or clinic only. Okay, so after becoming a registered nurse, you can develop your nursing skill in the following specialties. You can be in clinical, a trauma emergency unit, or you go for OT, surgery, oncology. There is those onco unit or palliative care. Neonate, you can go to be a nursery, working at NICU nurse or pediatric unit, or you can look after the geriatric, the older one. Okay. Specialty as per medical discipline, there is so many. You orthopedic, neuroscience, pediatric, midwife for delivery. Trauma is A&E, psychiatric. You can oncology. There is so many here. You also can go into renal, community nursing, and then you also can be a wound care or stomach care nurse. You also can be an infection control. So now each hospital, individual hospital, you must have an infection control. One is per 100 beds. Okay, so if let's say you have 100 plus bed, you need to have at least 2 infection control nurse there, so they can take turns. The main duty of an RN include manage patient care, educate patient and their family, assessment of patients' physical and mental wellness, assisting in surgery, perform clinical procedure, observing and monitoring patients, helping with rehab. So you can be a rehab nurse too, and comforting or counseling patient. You go to psychology care. Okay. So after you finish staff nurse, so you either diploma, you can go to your management, nursing management track, become a nursing manager. After that, you are promoting to promote yourself to be a senior nurse manager. From senior nurse manager, you can become a assistant director of nursing, that is in management. After that, you become a deputy. After deputy, there is the director of nursing. Some certain places, they will have a, like in hospital, they don't call director of nursing, they call matrons. Okay, matron 1 or matron 2. Then certain places, they call director of nursing. The nicer word is director or the chief nurse. After a director of nursing, there is individual hospital or individual state. Individual, that if government is individual hospital, that in the whole state, there will be like a state matron. Okay, state matron, there is state director of nursing. Then you go to federal, like Malaysia, there is a federal, there is a director of nursing. There is down there, there's a few assistant director of nursing that is in federal, in Putrajaya. Okay, the role or responsibility of a nursing management is to regarding manpower resourcing, planning, retention, evaluating and redesign the job scope and policy reviewer. Okay, then we also can go into nursing educations. Okay, in a healthcare institutions. In Malaysia, there is a lot of healthcare institutions here. There is, I think, like KDU, Masa College, IMU, AIMS, Oriental Lelam. There is so many here. But whereas in Singapore, there is only two main one, Nanyang Polytechnic or Ngee Ann. Okay. In Malaysia, there is a lot private colleges here. See, in a healthcare, nurse educator is they can become the junior, become a senior. Then after that is principal, the next educator. Then after that is assistant. Okay, it's the same as of management side, because the role is director of nursing in education. You can be, okay. The role of and responsibility is manage training and development of nurses, a plan, deliver and evaluate nursing program and courses. Okay. In academy, this is in colleges. In university setting, they call lecturer. Okay. They also plan, design, evaluate nursing curriculum, teaching methodology, conduct lecture, tutorial, and exam. Okay. So in clinical track, whether it's totally different, that is in bedside nursing. They are called, in certain part of the world, we call nurse clinicians. Like Singapore, they call clinicians. Like Malaysia is still calling staff nurse. Okay, you can become a senior, advanced practice nurse, APN. Then you become an assistant clinical director of nursing, and then you become deputy. Then in clinical area, there is so much an advancement in this as a nurse. The role and responsibility is you manage acute or chronic illness of the patients, initiate, implement, and evaluate treatment plan and service to meet patient needs, assist in training of nurses and healthcare staff. When we work in clinical, we also have to follow the clinicians, the doctors, specialists ordered, so we can discuss certain places. We discuss cases with doctors, see which one is the best treatment option for the patients. Okay, we also can be going to, furthermore, you can be a research nurse. Okay, you become a researcher, you become a scientist, nurse scientist. So to see which one is the best clinical trial, you can do clinical trial to best practice into how to venture to become which model is the best for the nurse for the treatment of the patients. You see, so the role is initiate and champion the nursing research. Why nowadays sometimes you see that why that you see some of the beds of the olden style is totally different from nowadays. So it's become, we are evolving, we research. So prevention of fall, how we want to go and prevent fall. So we will take out ideas and then let them be research it. So to become a better place for the patient to stay when they are in hospital. See, facilitate research effort with relevant healthcare partner. Sometimes we will work with the doctors or work with the clinicians and also the researcher to come out the best option for the treatment options. This is a few career pathway that in Malaysia that I can show to you. We have to have SPM or STPM. Then we go for 3 years for diploma. And then we work in healthcare institution. After that, we go for post-basic. Now, post-basic usually will be 6 months or 12 months for specialized area. So after in the specialized area, we need to go, you can go for, after the 6 months or 6 months, you can either go for degree courses for 2 to 3 years. You become a nursing sister, tutor, you can become a specialist in these places. So we go for this advanced level of nursing. Then then you slowly evolve up from staff nurses. You can have staff nurses 1 or 2. You see the senior staff. Then after that, you become a nursing sister. Then after, if you want to do, you can also from nursing sister, you can be going up higher, senior sister, or become a matron is as an administrator. You go for research, then you go to study your master in education, management, or clinical. Then you can also become a doctor. That is called, we call PhD or degree for nursing. So this is a Malaysia context of nursing career pathway in Malaysia. Okay. I summarize up a few. That is the same as what I taught just now, that we summarize it. You can go for clinical, you can go for nursing administration, nursing educator, you got any other nursing practice. You can also become a business entrepreneur. You can open up your own nursing home, or you can go for any other like daycare center. You can open up with this one. Then you go for research. Okay. This is a nursing career pathway in Singapore. Is also about 4 or 5 of them. I forget to inside because nowadays we deal a lot with IT. Like just now, we cannot get along with the IT thing. So it's informatic. So a lot of now we are paperless, not paperless. Okay. So a lot of things we integrate inside the IT system. So even the observation, whatever, we don't have to key in, is automatic link up with the IT. So the system, so is more accurate. Nobody can do chartology. It's all there, and then it will image out in the IT system. This is it. Hello?
I change slides.
Okay, you change slide. I change. This is career pathway in USA. So it's different. It's different. You see, in US there is a lot of career pathway. It's totally different. Some of them they go to APN. They can prescribe advanced practitioner.
The words.
Huh?
You can't see the words.
I can't see the word. That's why it's this one. It's very blurred. I tried to cut it down already. So this is I took out from this US. So advanced practitioner, they can prescribe a drug, they can give treatment. So of course they will also discuss. It's just like our Malaysia context, there is medical assistant. Okay, the senior medical assistant, they work in estate, they can prescribe drugs, but not the psychotropic. Okay. That's all I share with you all. Anything you can ask me?
Okay, I stopped the sharing. Okay. Okay, any questions at all? It is, to be honest, it's all over the place.
Yes.
Let me close this. And I think what is most important is this. Okay. Let me just share this one. Now, I am not sure if everyone is clear about this, but is there any questions at all? So this is actually the link for you to fill up to get the e-cert. Okay, I am going to send it to Facebook also. Okay. I think let's talk about your career. Okay, you were in China for a good few years. How many years were you there in China?
Oh, I have been there from 2012 until 2016.
And what was your job? What did you do in China?
Okay, I am the chief nursing officer there.
Mhm.
This is a nursing director there. Is to spearhead on project.
Okay, so for example, how do all the nurses that want to advance their career either in Malaysia or more so overseas, how do they look for jobs? Where do they look for jobs?
For me, I am being headhunted.
Okay.
So we go there. Actually, there is a lot of jobs that you can get it in nowadays for nurses. Ireland, UK, USA, Australia, Saudi, now they need a lot of nurses. So there is opportunity through the nursing agency. So you can apply through there.
Okay, so having said that, for all the nurses who really want to look for a job, you can send your CV to us, beatinghearts.life, our email, and we will, in that sense, help you look for jobs. Okay, now, how did you, I know your career has been for 30 years, okay, climb that ladder. What do you do to climb the ladder?
As for me, I work in government first. I was trained by JPA, Malaysia's contact. So I finish my contract. Then as a junior staff, we slowly go up. I finish it. I go. You have to have your willing to learn, and then just not to say that you are coming in to work only, then you go back.
So basically, like everybody else in every career, it's all very dependent on individual, not just your ability, but also your ambition.
Yes.
Whether you're ambitious or not, whether you are very willing to learn. Okay, that's true. But in your case, right? Okay, which was the turning point that spear you to upper management?
Okay, my turning point is when in 1994, okay, I came out with a 12 specialist consultant from a private hospital to set up a new greenfield hospital in Penang. That's my turning point.
Okay,
yes.
So basically, they took you from general from medical, MOH, and then you help them set up this center.
Yes.
Okay.
Before that, I also came out already. I was in a private hospital.
I see.
Then they see your performance. They say, yes. So will you want to join us? You know, all doctors, they want to set up a new hospital. They need someone that can plan, go and also how to get staff nurses for them. That is the point where I have my turning point in 1994.
Okay. Now I want to ask you, in these 30 years, you have achieved quite a lot. You are now, okay, what's your role now?
My role is very small only. I am a chief of nurse of Columbia Asia Terrace. I am just in a hospital.
Okay. How old are you now?
63.
So you are past retirement age. So basically you are just, okay.
I like to work. I like to contribute to the society.
Yes. Okay.
Okay. I also, when during my younger days, until today, I also go for NGO. Just like I also go for, in year 2006, if I'm not mistaken, there is 2008 or 2. There is a tsunami, right, in Penang. tsunami in Aceh, in
Yeah. Go on.
yeah, that is the time I go for NGO. Before that, I also joined the NGO group to go to for health screening to help them all these
Okay.
things.
What would you think is your strong point, okay, in achieving what you have achieved so far as a nurse in both management? Yeah. What is your strong point? Is it time management? Is it people management? Is it what?
It is included your time management and your people management.
No, you.
Myself, both
What do you think is your strong point?
time and people management, and also my passion in my work. You
Passion
have to
in
be
your work.
passion. If you don't have passion, Betty, I don't think that I will be staying until now.
Well, sometimes people can stay on for a long time and work for just money. Yeah, it is possible.
Yes.
So yes, I like to know. So somebody said, Rurin Singh Tongge, what a fun, cute name,
What is that?
says that at 63, you're still energetic. Really admire you. True. Sometimes age is just a number, which is very true. So
You need to have passion, and then you just have to take care of yourself. Like we must look healthy. You still have to. We also can learn from the junior one. Some of the younger generation, they are very good, especially the IT. I am still have to learn.
I can see you struggle very hard to share the slides.
I don't know, because sometimes I said I just have to do this thing. How ask him to do. I had to learn IT. Actually, you know, last time when we study, when we initially 40 years ago, when we got computer to learn, to take all our notes, it's all written.
Of course.
Yeah.
But I'm not much younger than you.
I know. We learn, right? We struggle, right? We write.
Sorry, I don't struggle with IT. I actually I mean, I cannot write programs and all, but I think I do like IT, and I like the online and internet, and yeah.
Last time we don't have online internet to get our this. If we had to buy tons and tons of books, you know.
Of course.
Now we so easily, the younger generation. I mean, in nursing, we can climb up to become a doctor too. That's why I said PhD. You see or not?
I think it's that is okay. I seem to I don't seem to be in the same frequency as you. As you speak and as I listen, I feel like I'm very different from you. Okay, and you're from your presentation. I'm not sure whether we managed to actually impart, okay, how far a nurse can go in their career. Okay, and I really want to, okay, because tomorrow is Nurses Day, I want to tell all the nurses that, okay, just like everyone else, okay, your career path is determined not so much on what you have been educated in. It all depends on you, okay, the way you seize your opportunity, the way you see yourself, okay, and if you allow your mind to be open, okay, you can go very, very far. And in actual fact, okay, a lot of nurses do not know this. Okay, every time people say, "Oh, I'm just a nurse," I don't understand the word "just." Okay, because do you know that nurses are the probably the most sought after profession anywhere in this world, anywhere. You can name it, okay? And nurses are so sought after, okay? It's just amazing, okay? You are like a commodity that is so precious, and you can travel the world. I've seen my nurses, okay, how they have grown by just working overseas. And they're doing clinical work, no doubt, but they can go so far. Okay, let me just see what Eng Yi Chuan said. Miss Irene, Eng here, thanks for the testimonial letter and the support you gave me when I was Penang. I already came back from Singapore and I'm currently working as a clinical instructor under UITM. Oh, good, congratulations. You have not just contributed to society, you have helped somebody advance their career. You've done well, Irene.
He worked with me. Then he went to Singapore, encouraged him to go.
Mhm.
Then he came back. Now he went for ICU course, if I'm not mistaken.
Yeah.
Now
So
he's
I think it's very important to impart that always try to improve yourself, always try to expand yourself, not waste, but always try to chase whatever knowledge that you can, whether it is by paper or by experience, or
Yes.
both. The best is both. You need that. Okay. And tomorrow is Nurses Day. Tomorrow we have another speaker. She's Miss Jayanti. She's a very influential lady. She's also introduced to me by Irene. So Irene gave me her contact number, and Miss Jayanti is and going to be and was I think she's going to leave the head of school for youth SCI, and she's going to further her career in management. And I think all the nurses here can learn a lot. And tomorrow she will tell us how important is this nursing career for public health, okay? How important it is, okay, that you guys are such important commodities. So join us tomorrow. Happy Nurses Day. Tomorrow we will come back at 9 o'clock.
Okay.
Yeah.
9 o'clock.
Irene, join us, Irene.
I will join because I will every time join you on every Wednesday.
Oh, thank you very much. But tomorrow is a special session because usually I do my session on Wednesday. And but tomorrow, because it's Nurses Day, I've invited Jayanti, Miss Jayanti. And then after which we will go on with, of course, our clinical webinar on medical topics like, you know, basically for doctors, but of course nurses are free to join, and we will give out e-cert still. So happy Nurses Day. I see you guys tomorrow.
Thank you.
Thanks, Irene.
Thank you.
Yeah, you can try to improve your IT skills.
Yes. My IT is very poor, I know.
Yes.
But not my work.
Yes, you've gone so far. You must always improve on your IT skill.
You see?
Yes, must. Everybody, bye girls, bye guys.
Bye. Thank you.
It's just amazing. There's so many male nurses these days, yeah?
Yes, we
Yes.
encourage them. In fact, the older time when we are at there, a lot of male nurses. There are a lot of male nurses. They are here. They will be working in like A&E, OT.
Yeah, no,
Some
but
of them they love to work in
I'm
orthopedic?
sure, of course, I'm sure. Of course, there are certain fields that male are more likely to like. But when I started training as a doctor, there were no male nurses at all.
They have, that time
Yeah,
have.
no, they
It's
don't.
just a minimal.
But there were HA and MA, but there were no male nurses. But
They
now I
have, they
see
have.
a lot of male nurses.
Yes.
I,
But a lot now, they like to be a nurse. They are very caring one. Actually, Eng is a nurse, is a male nurse.
yeah, of course, of course. Yeah, and as we can see, Eng has now gone to do teaching in UITM.
Yes, it's in KL.
Yeah.
Okay, thank you. See you.
Okay, see you. There's wait, hold on. Somebody made a comment. When I worked abroad for 13 years, somebody said we are encouraged to speak up among the, yes.
You never heard such word. I am just a nurse.
Yes. I don't like that word just. Okay, I cannot understand the word just. I delete it from your vocabulary from now on. Never say I'm just a nurse. Never.
In China, when I work there, the nurses are more powerful than the doctor.
Yeah, I mean, it's everybody work is it's not about power. It is about job description.
Yes.
For me, I'm just doing my job. You are doing your job. You're helping me, I'm helping you. So the word just, okay, so for Nurses Day, we would just cancel off the word just.
In Malaysia, a lot of people, because even I know when I started off as a junior nurse, we are just a nurse. The senior will tell us, please don't go and quarrel with the doctors.
Who's
Yes.
I think okay, people don't give nurses due respect.
Yeah.
And I think tomorrow we will speak about that also.
Yeah.
It is important to give everyone due respect. It's not just nurses, cleaners, okay, anyone. And
Yeah.
I think I mean, you see, recently I'm sure everybody heard about the house officer that killed committed suicide. I didn't read much about it, and everybody is saying that it is because of bullying. Okay, the very reason people bully others is because they are disrespectful, and we should never disrespect anybody. Anyway, I see you guys again tomorrow.
Okay. Good night.
Good night. I see you tomorrow. Do join us, all of you.
I will join you.
Yes, I've sent off all the Zoom link, and yeah, tomorrow is a special day.
I usually will join Facebook.
Yeah, but
it's easier to join Facebook.
Yeah, but because this is special for nurses, and if you join Facebook, we usually, you know, it's difficult to ask questions and all that stuff.
Okay, I will join Zoom link.
Yeah, you join Zoom link lah.
I also share with the girls of the hospital already.
Yeah, thank you very much.
Okay, thanks a lot.
Yeah, Tracy says, yeah.
Yes.
Every experience is very different. Every experience, okay.
So you all can write in, if any one of you want to go other country to work, can write into Meeting Hut. They will try to look out for you all.
Yeah.
Okay.
And actually, you can write to us about anything lah. I mean, it is a community thing. Yeah.
You understand what is the nurses feel?
No, it's not that I understand the nurses feel. It's just that I try to understand how everybody feel. Everybody. It's yeah. Okay.
Good night.
Bye. See you tomorrow.
Bye.
Thank you very much.
Bye.
Bye, Irene. Irene is gone. Bye, guys. See you tomorrow. Go, 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 go. Happy Nurses Day. Still, bye.